Someone rotation with Leanne right now over at Westwood Cancer Care Center, and she has me working on a few optimization project with the operations team. So I'm working with one of the technicians over there, Tiffany, on some inventory management as well as cost saving opportunities for some of the drugs that we keep here.
Hi, I'm Eric McBain. I'm the pharmacist in charge of the Cambridge Retail Pharmacy, and currently I'm working to prepare the pharmacy for the opening of 2 new floors in the Cambridge Tower, floor 8 and 9, which is roughly 100 new beds.
I want to share with you the project I'm currently working on, which is actually bringing some infusion chairs out here to South Lake that will be hopefully coming online soon here. We've got 10 chairs slated, and it's going to be approved for capital here in the next couple of weeks. More to come.
I'm coming up with the title of my grand rounds. You can't tell, I'm a new resident.
I am currently working on optimizing Epic to better care for our specialized patient populations, including pediatrics and our critical access hospital patients.
First thing I do when I come to work is caffeine. If you can't tell, I'm a new resident.
Log on to all our delivery services, Quicksilver, UPS, and 24/7. I print off all the delivery confirmations and attach it to the patient's profile.
Really kind of depends on the day. I may be rolling carts down back from the dock from the night before, packaging up, getting prescriptions ready to ship, or covering a shift if somebody is called in for the day. Really depends on the day.
I think, like, to get my day started, I just really like to maybe go get a cup of coffee, probably say hello to Kim, especially if I'm on campus. Because I haven't seen her since like last Thursday, so I have to catch up with Kim first. But that's how I get my day started.
First thing I do for the start of each day is I figure out which site I'm going to, since I move around the city a little bit. And then I always ensure that I have coffee with me, or that I know where the nearest coffee shop is to that location.
I log in and do my cycle counts. And what does that do for you? And make sure my inventory is correct so we have all the medications for our patients.
Well, I get a big old cup of ice water, and then I go to my coworkers and give them a big old what up, y'all.
I usually do Pilates or run for about 45 minutes to an hour.
I recharge for work by, after the day is over, going home and making sure I get a workout in. So typically I go on a nice long jog. I recharge from work by playing with my kids, cooking yummy food, and remodeling my home.
I do a little bit of exercising, and those exercises they range in things that I do, including a little bit of weight training, a little bit of jiu-jitsu, but mostly it is carting my kids around to activities, as well as wrestling with my 4-year-old. And this fall I'll be going to football games to watch my son during his senior year of football as a wide receiver.
So to recharge when I get off of work, I like to either read or play Nintendo Switch, but I also like to spend time with my dog and deal with his incessant squeaking of his squeaky toys.
Hi, my name is Sam. I'm the pharmacy technician with Outpatient Pharmacy. After work, I recharge by gardening.
If I were lost in a maze, I would call Steve Johnson to get me out of there, because with his military background, he can get me out of there quick.
I will call Kaylin to rescue me, because if I give her directions, she's gonna say, okay girl, are you sure? And I'm gonna be like, yeah, come this way, I left bread. And then I'll say, oh, there's a recipe for you to make to get here. This is what you need. And she'll go to the store and get those ingredients and make the recipe, and she'll find me.
If I was stuck in the maze, I would choose Brittany and Erica to come save me, because Brittany would bring me cookies and Erica would have a logical answer as to how to get out of the maze.
I would call Emily to make me laugh my way out of the maze, and I would call Brooklyn to actually get me out of the maze.
I would choose Sarah Smithstead to come rescue me, because she is like MacGyver-ette. She can do anything, and she would never give up until she found me.
I would probably call Allison Smith to help me, because either she she probably had a hand in helping build the maze. Or I would call Mika Rivera, because she's tall and she has a can-do attitude and she would find the way out.
You know what I really wish that everyone knew about being a pharmacy director is how much we as directors work across the pharmacy enterprise to make sure that our services are seamless and cohesive and provide exceptional care to patients.
I work alongside primary care providers to help patients optimize their medication management for their chronic disease states. I also like to say that I help patients feel empowered about their medications so that way they stay adherent to their regimen and we can also improve their health outcomes.
I've worked here for 2 months. If you can't tell, I'm a new resident.
I have been with KU for almost 14 years now. I think in a couple days is 14 years. I started in the retail pharmacy and did that for 5 years, and then started in the specialty pharmacy when that was brand new with just 2 of us, and that was 9 years ago, and now we have grown to a team of 13 PPAs. We started out with just cancer care and now have expanded to, oh gosh, I don't even know how many clinics, 10 plus clinics, 15 clinics at this point. So it's definitely grown a lot over the last 8-9 years.
I've been with the health system for 10 years now and with IDS for 7.5.
I've been here for 3 weeks.
I have a couple work best friends here. I do like everybody here, but I have come to really get to know Sam and Chassie.
My work best friend would have to be Gina Boom, and that's because she pushes me more every day to do my best at work.
My work best friend is probably Lucas Adam. He was a lot of help for me when I was first getting started, and he's able to answer a lot of the questions I had when I was first starting.
My work best friend is Scott over here. We've both been in home infusion for about 1.5 years. We started right around the same time, so.
My work best friend is Petal because she's awesome. I don't know if you've met her, but she brightens your day and makes you so happy and is always so curious about your life, and it's just really, she's just so warm. So yeah, that's my work best friend.
Who's your work best friend?
Miriam, we even look alike. And we have the same birthday.
My 2 work best friends are Liz Hazlitt and Jordan Adolphson, my 2 old co-residents. And I know that I can always reach out to them when weird things come up.
My work best friends are Ashley and Jacob, aka Schlee, aka Jacob.
Lindsay Fitzpatrick. I think I've known her since the first day I've been here at KU, and she's just awesome. I'm sad she's in ambulatory, but I think it's probably better that way. Otherwise, we'd just be talking all day.
My attention to detail.
My superpower is that I can run really fast.
I think as a pharmacist working in the healthcare field, one of my superpowers is I have a pretty wide knowledge of all different cancer states. While I specifically work in bone marrow transplant, we did training in a lot of different areas, so I'm a good resource for families, to ask us any sort of question about cancer or any disease state in general. So I feel like we're a really good resource for people.
That whenever I sit down in my chair, without fail, the doorbell rings. That's my only superpower.
I feel like my superpower is having a lot of compassion and kindness. It takes special people to get the job done, and when you're compassionate about your job, I feel like everyone wins, and that goes for the patients and your fellow coworkers.